Well, welcome. My apologies, we're a little behind in our videotaping, so this will encompass both updates for April and May. Um, Again, happy spring, lots of changes. As everybody knows at this point in time, VA is in the process of recruiting for a new secretary. Meanwhile, I think the message back to all of us is it's important that we stay focused on our key initiatives and our key goals. For us, nothing's really changed. We're still trying to make sure that every day we put veterans first in everything we do in every service, that we're creating a better place for our staff to work, for our employee satisfaction, and then lastly, that we're creating a culture of openness, fairness, and excellence. If they stay at the center of everything we do, we'll continue to make progress. In April, we had a pretty productive month. Former Secretary Shulkin was here for a summit with Senator Carper. It was well attended by elected officials both in New Jersey as well as in Delaware. There was good feedback to us. A great deal of progress was noted. However, we were also encouraged to keep pushing forward, particularly looking at access, veteran satisfaction, and restoring some of our foundational services that have gone dormant here over the last 3 to 4 years. That work continues for us every day. I think for us going forward, some of the key initiatives that I think will help with that restoration process is we were fortunate enough to work with Philadelphia and the VISN. Dr. George Zanis has now joined us as the acting chief of staff here in Wilmington, and he's meeting with the clinical leadership to help us refocus and reset priorities there. Kathy Craig has been selected as our nurse exec, the AD for Patient Care Services. She'll be joining us in May. So they're two exciting additions to our leadership team that I think will begin to make a difference for us day in and day out. What does that mean? It means we need to continue to work on some things that are going to make a difference. Sometime in May, we're expecting to add back orthopedic surgery. Dr. Jerry Fody will be joining us and functioning as an orthopedic surgeon here in Wilmington, restoring that element of care that's been missing for some time. We continue to work with our inpatient units to look at reconfiguring our beds, establishing intermediate beds, sort of a go-between between the ICU and the units, to make sure we have the right level of care for our veterans. We're also going to continue to work on that transition unit, but more importantly, we're going to work with Dr. Scott Shreve and the team at the national level to look at restoring our hospice beds here in Wilmington. So all really positive things around growth that we want to focus on. And it makes sense when you look at our population. We have an aging veteran population. We don't really have medical hospice beds here in Delaware. We are the only medical center in Delaware. We need to provide this service. So Dr. Shreve's going to help us restore that. Our hope is sometime in 19 we'll be ready to go forward with that. We've put forward some solicitations to expand our CBOCs, both in southern New Jersey as well as in Delaware. Unfortunately, our proposals for expansion in Cape May, where we were looking to go with 7,500 square feet of new clinic space, we didn't get developers that adequately responded to that RFP. So we're back working with contract to get that redone and get that reset so that we can look at expanding the footprint of where we would potentially place that clinic, looking at Cape May Courthouse all the way down into Rio Grande. So we're hopeful sometime in May to get that solicitation back out on the street. We have been moving forward with a sources sought for Dover. 21,000 square feet is what we're looking for. That's on the street right now. It will close in mid-May. Hopefully we'll have some developers interested and qualified, and we will quickly follow that up with a solicitation. So again, the strategy is make sure we have our foundational services in place here at Wilmington, as well as then growing our footprint in the community, having a greater presence in the community. To that end, we've been growing our community access. We're doing quite well in the number of new veterans signing up. We've got about just under 6% growth this year. So that's a tremendous plus up. Our greatest growth is occurring both in the Atlantic County CBOC as well as in Dover, and we want to continue to do that. I think we're going to add some additional outreach events for Delaware, so more and more veterans down in the Georgetown area can be enrolled with us in VA. But they're not going to enroll with us unless we're achieving our 3 critical goals that I talk about at every meeting, as well as then focusing on veteran satisfaction. As a facility, we've been struggling with that. Our inpatient scores are going down, our specialty care scores are lower, and our primary care scores have also been decreasing. Everybody's pleased with the technical quality. It's sort of the bedside manner and the soft skills that we need to work on. There's data posted on the internet. I'd ask everybody to go and look at it. We're going to start some campaigns in primary care where we're going to get some immediate feedback from veterans, do some service recovery in those clinics. Dr. Slavinsky and Dr. Qureshi will take leadership roles there. We're going to be using that information to drive some systems changes, as well as give providers feedback about what they could be doing differently. In the end, what we need to make sure happens is that our veterans trust us, they feel confident in us, and that we feel that we care about them. What we don't want to get caught doing is just checking the boxes, completing a lot of reminders and performance measure things without conveying to the veterans we actually are concerned about them and their family. So asking questions about stress, is there anything else we can do for them? What else can we do to make sure they get the care that they need? Those things need to be put in place. To that end, the other big changes we're making is in care in the community. We've restructured that program. It's no longer reporting administratively. It's now going to be reporting clinically. We're adding nurse navigators. We're decentralizing the programs, pushing those services out into our CBOCs next to our PAC team, so that when a veteran presents for care, if it's something we can't do inside VA, the navigators will work with our PAC teams to get that care coordinated in the community. Our goal would be to get those appointments set up either same day or very quickly after the initial appointment. The navigators making sure that everything gets tied together, not only for the veteran and the family, but there's communications with providers, that authorizations are in place after the care has been delivered, whether it's an assessment or a treatment episode, that all of that then gets back into our records so that there's good partnered coordinated care. That's underway. I think we're going to see some changes in that program. Hopefully our progress and our performance will improve. That will be a big area of focus for the remainder of this year, kind of getting that program restabilized, growing this new model, and anticipating that the Congress will be making some changes to the choice program. Just so everybody knows, we're anticipating that the contract with HealthNet will end from a financial standpoint sometime at the end of May, beginning of June. We'll then be looking to use more provider agreements at that time. The contract will officially end, meaning it will term out on September 30th. There'll be new contracts put in place, but we're really waiting to hear back from the Hill on legislation and how they will be revitalizing and redefining the choice program. So more to come in future meetings. That will remain a focus. The other big updates that everybody needs to know about is that VA has gone live with VA Text, which is an opportunity for our veterans where we have their cell phones to be given notices both 7 and 2 days prior to their appointments. They can text back and either cancel that appointment or confirm it. So it's a way that should help us cut down on some of the no-shows and cancellations that have been occurring and provide more focused patient-centered care as we go forward. We'll continue to stay focused on access. We're doing pretty well. We're struggling a little bit here in Wilmington with our timeliness for new patients. We seem to have good follow-up with established patients, kind of getting them seen within 2 to 3 days, both for primary care and for mental health, but we're seeing some lengthier time periods getting new patients into primary care here, so we'll be working with Dr. Qureshi and Tiffany and the team to make some improvements in that area as we go forward. We'll continue to look at the CBOCs. We're doing fine there. We still have same-day services, so if somebody's in crisis, they can see somebody from their team same day. We can get the care started and coordinated. So that's all been positive, and it's helping to drive some successful changes and better outcomes for our veterans and their families here in Wilmington. They're the key updates. We'll continue to keep you informed. The big things to keep in mind is the changes to care in the community, anticipating the changes to choice, the new VA text program, our focus on our beds and really kind of getting them redistributed, our plans to move forward with reestablishing hospice services here, and to continue to look at our veteran satisfaction scores, their subjective experience of how they see the way that we're providing care, so that we can clearly convey to them in every appointment, in every session, that we do care for them, we do value them, and we want them to be our greatest ambassadors out there telling other veterans about who we are, what's different about Wilmington, and why they should get their care at Wilmington. So we have work to do there, but I'm confident that with Dr. Slavinsky and Dr. Qureshi working together, we'll make the needed changes and clearly demonstrate that we care about our veterans, and that's illustrated every day by the way in which we offer the care to our veterans and families. Have a great month. I look forward to updating everybody in June, and I appreciate all the great work everyone's doing. Thanks.